Sitting down with Dr. David Klein of the Stages of Life Institute. I want you to look up suffernomore.com, and, of course, stagesoflifevitamins.com. Right now, we want to talk about pain. It's been in the news a lot. There's an awful lot of legislation that could affect your cures for pain. So, Doctor, what's going on?
Yeah, what seems to be interesting here is that we have a crisis, an opioid crisis. People are dropping dead every day from abusing themselves, taking too many medications, then ending up dead. Well, true enough, that's absolutely the case. But the problem has been misidentified, and this is going to impact upon many of you listeners rather directly. Why? Because pain is the single most prevalent, it's the most prominent, it's the most common of all complaints that brings anybody to the doctor's office. You don't go there for social reasons. You don't go there for grins. You go there for business. And what's the number one? Pain. Number two, bleeding. Number three, 4, 5, and 6, many different choices. But pain is number one far and away. And one of the mainstays of treatment of pain is the use of painkillers. Wouldn't you know it? We don't give pain medications to make more pain. We give it to ameliorate it, to reduce it, to get people back to function. And there's certain classes of pain medications that are now under attack. Now, should they be under attack? No, the prescribers should be under attack. The people that are abusing it, selling it, marketing it, out on the streets giving it to our kids, they need to be attacked. How about let's start by enforcing the laws? Unfortunately, that's not the way the government works. They're going to go after the low-lying fruit. That happens to be you. Okay? Who else? The docs. So first thing they're going to do, and first thing they've done, is attack the surgeons, the internists, the family docs, so on and so forth, because they're the ones that are thought, quote unquote, to start the addictive process. But this couldn't be further from the truth. Individuals that take pain medications for pain rarely, read me, rarely become addicted to pain medications. It's the individuals that take it for other sorts of things like recreation, like feeling a little bit better. When somebody takes a medication to feel something, they are the ones that are at risk for developing addiction. Now, when you're a trained professional, somebody that knows, has seen, and actually understands the nature and the treatment of pain, you pick up on these sorts of people fairly easily. There are written tests that you can give that'll identify some of them, although most of these people are smart enough to know how to evade it. We do urine toxicology studies to pick up those people that are better than we are at seeing these evasion techniques. But the fact of the matter is, and the fact remains, that opiates are very, very useful to treat chronic pain. Now, what is chronic pain? And this is where the problem is located. Chronic pain isn't a time frame. Okay, chronic pain happens to occur when you have an unrelenting problem. Now, the diagnosis of chronic pain is pain that lasts longer than 6 weeks. What's so magical about 6 weeks? And the answer is nothing is magical about 6 weeks. But I'll tell you what, if you have a toothache, it hurts. Okay, if you don't do something about the infection, if you don't do something about the fracture, it can last years. That doesn't make it a chronic pain issue. It makes it an acute pain issue that has not resolved. Those are two very, very different things. If you have a broken bone and it mends, that's an acute pain issue. How long does it take? It could take 3 weeks, 4 weeks. How long does the pain of a broken bone typically last? The answer is 3 days, 2 days. So the government is correct when they say, well, we're only going to allow you to write these prescriptions for 3 days unless there's a medical necessity. I can't remember the last time I wrote a prescription that I didn't think was medically necessary. So it's kind of an odd bit of assumption on the government's part that we're doing things because we think they're fun and games. They are not. But let's say that you've got a problem that isn't going away, like lupus. You've got a problem that isn't going away, like ALS, MS, rheumatoid arthritis, or how about facet arthritis, which is something that every adult in the world has? Rotator cuff tear. How about tendonitis in the knee? How about gout? There are many conditions that stay. They come and they stay. Now, they may become exacerbated. They may go into remission. They come and they go, in other words, like migraine. But migraine sufferers are real. These headaches are severe and they can be incapacitating. To deny these individuals their medications because of some capricious 7-day limit is nonsense. Now, is it going to hurt me personally? The answer is no. Why? Because I have the education, the boards, and the licenses that allow me to write these prescriptions as I see fit. But how many pain docs are there? And how many good pain docs are there? Because there are even fewer. Okay, most of the people out there that call themselves pain docs really aren't all that good. That happens to be the way Florida medicine operates, so get used to it. Not everybody is going to be the first violin in the orchestra, if you get my drift. So you have to get out there and understand what is going on. The pharmacists, okay, now you want to talk about somebody who's gotten thrown under the bus. Now, there's no love lost between me and most pharmacists. Okay, why? They wear a white coat, call themselves doctors, and they try to pretend they are, but in this circumstance, they got thrown under the bus because they're the ones that are going to be responsible largely for identifying abuse. Now, that's a tough thing for somebody that's never treated a patient in their life to figure out. So this is where it's going to start getting challenging. The better pharmacists, some of the ones with gray hairs, beards, and perhaps a little bit of experience behind their belt, okay, are going to be the ones that are going to be your best friends. Why? Because you get some of these younger ones, some of the ones from let's say, Asia and so on and so forth, where guess what? They look at a number and they figure you should be that number. You may have a hard time getting your medication. So this is a real problem. I'm not sure where it's going to end. Usually these pendula swing one way and then they swing the other. This pendulum is swinging far to the left. I'm not so sure that I like the way that this is going. But it is what it is. So if you're out there and you're receiving chronic pain medications and your family doc is the one writing the prescriptions, my advice to you immediately is to find a certified pain physician to start assuming control of that medication. Because if you don't, you're going to be thrown under the bus in July. When these laws start going into effect, there's going to be something very much akin to musical chairs. Okay, the music is going to stop. People are going to start scrambling looking for a chair. And if you're left out, no seat, you're SOL.
So the legislation, as I understand it, says you can only get 3 days of prescriptions.
That's correct, okay, for an acute process. So if you go in and you have a sinus infection, you might walk away with a 3-day prescription. Okay, if the doc thinks that it's going to last longer, you might walk away with a 7-day prescription. Having had sinus issues for most of my life, I can promise you that these problems are not 3-day or 5-day issues. Let's say that you're going to go ahead and have surgery. Now, a lot of the surgeries that are being done right now, they send you home the next day. That day, the next day, or 2 days later, you're not in the hospital long. Okay? They're not around to take care of you. Okay, so what do? Well, we can only give you a 3-day prescription? Or you have to hobble in to see a guy like me. And so therein lies the problem. I'm not particularly happy about this. I think that the public has been walked over on this one. It's not going to end well.
Do you think that there will be new legislation maybe next year? Florida has a tendency to go both ways.
Oh, yeah. Oh.
I mean, they'll swing the pendulum one way, and then they'll see the effect of it, and they'll go, whoops, let's do another one.
Yeah, that's basically the law of unintended consequences. That is probably the best law that this, our legislature ever passes, is the law of unintended consequences. Things happen, they can't figure it out, and then you have to start assigning blame. And it's never at the level of the legislature. The blame is always to be found someplace else. I think that if they were issued mirrors, they could find the problems a whole lot easier than they can right now. But at hand, we have a crisis. So if you are somebody that requires these scheduled medications and you know who you are, it doesn't have to be OxyContin. It doesn't have to be oxycodone. It can be tramadol. Simple little tramadol. It could be hydrocodone, Norco. We used to have those things. They were Schedule 4 up until the feds changed the designation on that one. So there wouldn't have been an issue here. Now there's a big problem. So if you're receiving these medications on a chronic basis for things like back pain, chronic headache, shoulder pain, you're at risk. Cancer's a funny one, okay? They always look the other way for folks that have cancer complaints. Now, I'm not going to tell you to go out and get cancer, but if you have neoplasm, okay, or you've got a short time to live, or if you have a measured length of time to live, they tend to not be quite so difficult with you. So the documentation on the prescriptions is very, very important. The doctor should, and this is the only time that I ever do it, indicate on the written prescription what the diagnosis is. That way the pharmacist can see it, know that you qualify for this, and on it goes. So my software permits this. I don't know how other people are handling the crisis.
All right, very good. If you want to know more about the doctor himself and the practice at Stages of Life, go to suffernomore.com, suffernomore.com. And if you want to put yourself on a good regimen with your nutraceuticals, to supplement your diet, things that your body is in need of, well, then you sign up for stagesoflifevitamins.com, stagesoflifevitamins.com.